A new business ecosystem has emerged for telehealth and virtual care. It's both an opportunity and threat for stakeholders. This networking discussion will focus on platform business models and strategies for the new and emerging telehealth virtual care ecosystems. Please welcome our speakers, Seth and Vince. You can introduce yourselves and your background. And I do encourage all our participants to use the chat function on the right side of their screen. Vince has already put some instructions in there for you about resources and slides, but I'll turn it over to you, Vince and Seth.
Thanks, Steve. Hi, I'm Vince Karitis. My company is a consulting company, Better Health Technologies. Seth, your introduction?
Hi, everybody. Thanks for joining. Seth Joseph. I am Managing Director of Summit Health, a boutique management consulting firm.
We hope you'll find our presentation to be thought-provoking. We encourage you to make the slides as large as they can in your presentation, because we will be focusing a lot of our discussion on the slides. So let me open with a hopefully provocative question. Okay, so the first question is, what do all of these have in common? I'm going to give you 10 seconds or so to take a look at the list and offer your own thoughts. Okay, the answer is that these were all disrupted by smartphones and smartphone operating system platforms, Google Android and Apple iOS. So let's take a look at a similar healthcare list. And the same question, what do all these have in common? Again, I'm going to give you a chance to look at this list. And in particular, I want to draw your attention to the items on the right, functionalities or apps that may be more traditionally associated with electronic health records. We'll talk about that later, but just take a look. What do these have in common? Okay, the answer is that these are all potentially disrupted by virtual care platforms. And we show examples of virtual care platforms in the bottom right. Companies such as Amwell, Teladoc, MD Live, Amazon Care, Walmart's entering this. There's many others in the marketplace. So here's an overview of where we're going to take the session today. We'll spend a couple of minutes providing a little bit of framing and introduction about platform strategies. Second, we'll pose a question and give a tentative answer. Will virtual care platforms become healthcare's mega platforms? And then we're going to have a question and answer session. We'll pause for up to 5-6 minutes. Don't know how many questions we're going to get, but we would like to make it as interactive as we can. And then Seth will discuss implications of VCP growth and consolidation. And he'll address it in terms of the different stakeholders that are listed in the list that you can see. And finally, we're going to end with another Q&A session. Again, we don't know how long that's going to go, how many questions we'll get, but we do want to make it interactive. Okay, so a couple of slides, just a couple of an introduction and framing to some of the things that we're talking about relating to platform strategy. Seth?
Thanks, Vince. Many people think about platforms as a technology construct. What we mean is platforms as a business model. Companies that bring together different groups of users onto a common platform to exchange information, goods, or services, and in which the value of the company operating the platform grows as the number of users grows. Vince has already given an example of a platform, smartphone operating systems, which connect third-party application developers with consumers. We'll talk about some more examples as we go along.
Okay. So we'd like to orient you to what we mean by the virtual care ecosystem. Triple Tree Investment Banking Company has created an excellent framework, and you see that on the screen. They begin by defining three categories shown here. First, triage and intake. Second, care delivery, both virtual and in-person care. And third, home-based patient monitoring and engagement. Okay, Triple Tree's framework is far more extensive than this. And the bottom half of the slide, which we don't have time to go into, gives you a lot more detail. They also have a 74-page report, and that's referenced on the left of the slide. The slides are available in several locations. They're available in the Resource Center. I've put in a link in the chat. And also on my tweet stream at Vince Caritis, I've put in a link. So we would like to make the slides very visible and available to you. Again, there's a lot more detail that we just don't have time to get into today. While there have been many companies that have technology platforms, healthcare has been lacking in mega platforms. Platforms such as Google, Facebook, Amazon, you're familiar with all those names. They make up about 25% of the stock market today. One of the greatest and most comprehensive platform success stories has been SureScripts, a company that Seth has previously worked for. So, Seth?
Thanks, Vince. So SureScripts may not be a mega platform, but it is the first example of a national platform in healthcare that is scaled to processing more than 17 billion clinical transactions a year. And it's changed our experience at both the doctor's office and the pharmacy. No longer does the doctor hand us a paper prescription. Instead, we're asked, where would you like the prescription sent? SureScripts connects more than 900,000 prescribers on the left-hand side with more than 65,000 pharmacies. Today, more than 80% of all prescriptions are sent through SureScripts. And SureScripts has seen tremendous growth over the past 15 years. It succeeded because of network effects. The more pharmacies that adopted, the more value there was to prescribers, and so more of them adopted. And the more prescribers that adopted, the more pharmacies adopted because they didn't want to be left behind. Network effects and demand-side economies of scale speak to the fact that the value of the platform increases, or the value of the platform itself, I should say, increases as the number of users increases. It's an incredibly powerful concept, the same one used by platforms that Vince has mentioned, Facebook. Additional ones are Airbnb and Lyft. This is hard work, and for SureScripts, pharmacies came first. They were the chicken or the egg, I can't remember. But pharmacies came first, and it was only when 4 out of every 5 pharmacies had adopted that prescribers overcame the adoption chasm. Once they did, however, they came fast and at scale, something Vince will speak more to.
Okay, so this section becomes pretty meaty. We'll ask you to pay attention, and hope you'll, again, find it an interesting comparison. We pose a question here. Will virtual care platforms become healthcare's mega platforms? We believe that this potential is very possible, although we won't say it's certain. In this section, we'll take a look at industry characteristics that can create winner-take-all conditions. By winner-take-all, we mean markets that are highly concentrated. A monopoly, one company. Duopoly, where 2 companies are winners, such as the smartphone OS market. Or an oligopoly, a small number, perhaps 3 to 6 companies that become the dominant companies in a marketplace. Okay, we wrote an extensive article about this in last Friday's The Healthcare blog. And a link is included in the chat for a much more detailed perspective. It's also in the resource library. Okay, so this slide shows you the evolution of the smartphone operating system over a period of about 7 years. If you go back to the year 2006, there were 12 companies offering smartphone operating systems. By 2009, there were 5 companies viably left standing in the race. And by about 2011, the ultimate winners were becoming apparent. So if you look at the slide at the very right, what you see is that collectively, Google Android and Apple iOS control over 99% of the marketplace. It's a duopoly marketplace. We learned a lot of lessons from the smartphone OS war that healthcare should take heed to. First, the power of platforms to reshape industries and how this can occur rapidly. That there's more than one possible route to success. Apple iOS really was much more about selling hardware for Apple, whereas Android, less of a profit-making venture and more about Google extending its tentacles in search and advertising. And finally, the nature of the structure of the industry, few winners, many losers. Okay, this is really the Moneyball slide of our presentation. And there's a lot of detail behind this graphic. And in a moment, I'll just give you the headline. But let me walk you through what the different columns are. Okay, the left column lists industry characteristics that produce winner-take-all type of marketplaces, and we list 4 of them. The center column gives a summary of how these characteristics have played out in the smartphone OS war. And the right column displays our take of how these characteristics have potential to play out among virtual care platforms. And we're talking over the course of a decade. We're taking a fairly long perspective. So here's the headline. The big idea is there's many similarities, we believe, between the duopoly smartphone operating system market and virtual care platform and virtual care platform marketplace. There are 4 characteristics. All of them are described in detail in the article that we mentioned to you. And I'm just going to go over one of them, given the time constraints that we have today. I'm going to go over number 2, which is the existence of network effects and how strong these network effects are. And I'll start by saying, network effects are really the sine qua non of platform strategy. That's really where you get a flywheel, a positive effect, and growth occurs organically. So let's look at characteristic number 2. Are there network effects and how strong are they? Okay, in the smartphone OS market, the network effects were extremely powerful. The venture capital firm NFX describes at least 15 different types of network effects, and we don't have time to get into all of them. In the smartphone OS market, cross-sided network effects were very strong. These arise when third-party complementary goods and services in this case, apps are present. So today, Android has over 3 million apps and iOS has over 2 million. And that's very much where their network effects come from, because there's a lot of things that you can do with these platforms. We believe the VCP market also has very strong potential for cross-sided network effects. An example of this, Amwell recently announced their new open architecture platform with 5 new partners. Okay, we believe this could be seen as a first step, and that is it's likely or at least possible that VCPs will open up app stores in the future. We also see the potential for strong data network effects in healthcare. So the way that works, data can create a strong flywheel effect. A platform with more patients will have more data. More data will facilitate more and better analyses. Better analyses will fuel better clinical protocols, which in turn attract more patients. So, et cetera, et cetera. And that's how it continues. Again, we encourage you to read our article in the healthcare blog, and we just don't have time to get into all the details today. But the headline, again, we see many similarities. So to answer the question that we pose, yes, we believe there is potential for VCPs to become healthcare mega platforms. There's many common characteristics. Excuse me for a sec. Okay, how many companies? We don't think a monopoly or a duopoly is likely, but we can easily foresee a monopoly of 4 to 6 dominant companies. In any event, given market characteristics, and we're already seeing this now, we foresee dramatic consolidation, many mergers and acquisitions, lots of losers, and a few very big winners. And now we'll address some of your questions. So are there any questions that we can talk about? I don't know. I'm going to open up the question sessions. Seth, can you help me out here?
Absolutely. Yeah, please feel free to submit any questions through the chat on the right. There's also an opportunity for questions to be submitted separately on the left-hand side of the screen as well. And Vince, one question that we've got is it a good thing if virtual care platforms become a mega platform?
That's a really good question, and it's I think in our discussion today we're being fairly agnostic. We're just describing what can happen. But if you look at the other mega platforms, Apple and Facebook and Amazon and Google, they've been seen as bad actors, and I think deservedly so. So there will be a need for some oversight, and there were going to be issues around antitrust. There are going to be issues around privacy. So we don't directly address the question of whether or not this is a good or bad thing. That's probably a whole nother presentation and a whole other article, but it's certainly a relevant consideration to take into account. Okay, I'm not seeing any other questions, Seth. Should we just move on? Or do you have any other questions?
I don't think so. I think we can probably move on, and folks encourage you to put any questions in the chat box and on the right, and we'll be happy to address them.
Okay. So on to the next section. And let me get my clicker to work here. Okay. Seth?
Okay. We're going to next talk about some of the implications for stakeholders about virtual care platform growth and consolidation. So I spoke earlier about how SureScripts had to get 4 out of every 5 pharmacies on board the platform before prescribers started adopting in large numbers. That's how SureScripts solved the chicken and egg adoption problem. For virtual care platforms, the challenge for a long time was how to cross that adoption chasm. It can feel like an uphill battle until that point. Well, it took a pandemic to do it, but COVID-19 has solved the chicken and egg adoption problem of who would adopt first, consumers or doctors. We're now past that into the snowball effect. The question for everybody in the audience is not if you're going to be impacted, but how soon you're going to feel the impact and whether you take advantage of it. So let's talk about impact. There's a lot here, so I'll just hit the high points. A McKinsey study suggests that 20 to 30% of care can be virtualized. For the delivery side of healthcare, which frequently operates on slim margins, seeing even a fraction of this magnitude would be transformational. We see primary care as an area of focus and tension. There's the potential for primary care to be commoditized, but it's also an opportunity for organizations to look at primary care to build relationships with patients and differentiate themselves. We'd also note that there are many unknowns still. What will Congress and CMS do regarding telehealth regulation and the public health emergency waivers? How will payers respond? And many more. As we move to the impact for virtual care platforms, we see a mostly blue ocean environment, lots of growth to go. While telehealth utilization has come down from its peak last April, it's still more than 5 times its previous levels, and we see opportunity for further tremendous growth. There's also significant opportunity here around specific conditions and populations. While the initial virtual care platforms focused on breadth of clinical scope, we now see opportunities for specialized areas of focus. Whether these companies can succeed and scale on their own or exit by selling to the Amwells, Teledocs, and Doctors on Demands of the world is yet to be seen. We do foresee a period of stress for local providers. Local providers already compete against other local providers and national providers. We're now seeing more competition in the form of national virtual care platforms, such as those some of those Vince has mentioned, Amazon Care and Teladoc. We're seeing more competition in the form of payers who are investing in virtual care platforms to utilize as digital front doors, and further competition from specialized virtual care platforms. It will be important for local providers to become educated to understand which virtual care platforms they might want to work with, because virtual care is now table stakes, as well as which ones to stay away from because they represent competitors. We'd encourage you to take a look at our article yesterday in Forbes entitled "Healthcare Delivery Disrupted: The Rise of Platforms" for more information on how virtual care platforms and platforms in general may impact providers. For health plans who have largely viewed virtual care platforms with a dose of skepticism and concerns about quality and overutilization, we think there is massive opportunity, but it requires mindset shifts, plural. Shifting from thinking about overutilization to how virtual care platforms can be used to reduce utilization of high-cost services, and shifting from thinking of their business as administrative only or administrative primarily in nature, towards thinking of themselves as coordinators or even providers of care. There are signs that we're starting to see this. In a recent investor presentation, Anthem's CEO spoke to a slide showing themselves as a digital platform company. Likewise, Oscar is opening up access to its tech stack in an effort to invite in collaborators and innovators. So last, we'll focus for a moment on investors. There's an important question for investors. How long is the window of opportunity open? What is the right window of opportunity for investing in virtual care platforms? We think the window is quite large and long, but it's more attractive in certain areas than others. As I mentioned earlier, we see tremendous opportunity for specialization. There's a lot of activity in mental health due to the pandemic, but we also see opportunity by condition and within specific populations. Importantly, we'd also note that for investors and founders seeking to build true platforms of the nature Vince has spoken about, such as smartphone operating systems, and those that rely on network effects. Platform investing requires a fundamentally different mindset from software or tech investing. Thinking about pricing power and revenue growth metrics early on may be less important than the speed of building out the network of users and starting to achieve network effects, or the flywheel that Vince mentioned. So that's what we've got in terms of prepared comments on the implications of virtual care platform growth, and certainly look forward to answering any questions.
We don't have any questions in the queue. We have a shy audience, so I'm going to toss out a question. We haven't specifically talked about this, but I think it might make for an interesting discussion because we've got about 5 minutes left in the presentation.
Sure.
So we've talked about the idea, Seth, that the companies in this market space have very different business models. Let's kick that around a little bit. I'll give you a chance maybe to talk about the specific different companies and how they're doing things similarly or how they're doing things differently.
Wow, that's a big question, Vince. I'll take a shot at it. And I'll note, I think we recently saw Teledoc's earnings and Amwell's earnings, and they were on a size and scale of revenue standpoint quite different. And I think you rightly noted that Teledoc is going to market, selling themselves as a virtual care provider, largely selling to health plans. And so their revenue is largely service revenue. When we look at an organization like an Amwell, they're really touting themselves as a true platform play. So they provide software and make it available to health plans. They also make it available to providers. And they do have their own small network of Amwell providers. But as I understand it, that's largely to provide for excess capacity. They're not trying to build out their own network of providers in a similar fashion as Teledoc. And I'd encourage you to, Vince, I know you're very familiar with the area.
I'll just comment briefly. I think Teledoc acquired InTouch Health last summer. So they're, also very much touting themselves as a technology company. It's going to be interesting to see how much interplay there is between the technology and the services side. We've got several questions now from the audience, and I'm just going to take them in the order that they came in. You talked about moving to 4 or 5 platforms in the next 10 years. Right now, I see patients as primarily loyal to their provider and at the mercy of whichever VCP, and I can't read the rest of the question, but I presume it's going to say whichever VCP the doctor is choosing. You want to comment on that?
Sure. I think it's a great point. And in fact, recent data, we'd encourage you to look at Rock Health's survey on consumer adoption of digital health tools. They found very similarly, as you've noted, Sydney, that many patients still rely on relationships with their primary care physicians or their primary care, or their general practitioner or their family physician. And so they will use whichever virtual care platform that physician uses. I think what we may see over time is, for instance, there are going to be winners and losers, as Vince has talked about, and as some of the winners out there start being more effective at selling platforms and getting physicians on board, we might start to see a tipping point where we start to see patients start to migrate over to those platforms. And I think it's a good point. There may be a lot of interest by platforms to cater to physicians because of the importance of workflow. Vince?
Yeah, so I'll take a whack at that question too. It's very early. I think we're going to see a lot of segmentation in the marketplace, and it's not going to be a one size fits all. For example, a recent HIMSS survey looked at preferences for either centralized national platforms versus going to your doctor. And what they found was a tremendous amount of differentiation by age. And not surprisingly, the millennials were more prizing of their convenience and their time. And in fact, the HIM survey found that there would be even a willingness to pay out of pocket for that kind of convenience. Whereas at the other end of the age spectrum, baby boomers were much more interested in saying, I want my doctor. And it's such a land grab marketplace right now that there's really plenty of room for and plenty of room for both of those models to take hold. And that's what makes this market so interesting right now. So another question: what's more important in national telehealth providers, the technology platform or the proprietary networks of clinicians? Boy, what a great question.
Vince, do you want to go first on this one?
No, I'll let you go.
We do have about one more minute, just to time it.
I think they're placing different bets. If you want to be, as Teladoc seems to be, building out a network of providers, then absolutely the network and the breadth and depth matters. If you are taking more of a platform approach, then the technology and ability to match patient needs to consumers may matter more. On the other hand, with some of the specialized providers, it may be more about building a longitudinal relationship with the patient and ensuring that you've got right coaches, behavioral health specialists, et cetera. Vince?
Yeah, so my quick answer would be, I think if we're going to see a mega platform in this space, it's going to be important to build out both sides of this marketplace. They'll need to be very attractive and user-friendly on the patient side, offer a wide range of services, and very attractive to the clinician side to offer benefits and a good working environment, opportunity to work from home. So let me just take maybe a few seconds to sum up. We very much appreciate your joining our session. Feel free to contact us through Twitter or email if you have additional questions. The takeaway, I think, from today's session is pretty simple. It's we saw a duopoly in the smartphone market. We see parallels in the virtual care platform market where we could see similar marketplaces. It's really interesting times ahead. So stay tuned, and I'll just give a thank you and give you a last chance to say goodbye as well, Seth.
I'll just say, really appreciate it. This has been a fascinating topic to explore, and hope everybody enjoyed it as much as we did digging in.
Thank you.
Good. Thank you so much, Vincent and Seth. And one more time, what's the best way people can reach you and get a hold of your information? You said Twitter and
is on the slides. The slides are in the resource center. They're in the chat box. I put the slides on my Twitter feed.
Seth, same.
Absolutely.
Great. Thank you very much, and thank you to our audience. You've been great.